Have you ever found yourself wide awake at 3 in the morning, staring at the ceiling, your mind racing even though your body is exhausted? Perhaps you've spent hours tossing and turning, desperate for sleep that just won't come. You're certainly not alone. This frustrating experience, this yearning for rest that eludes us, is a reality for a significant portion of the adult population. It's not just a bad night. For many, it's a persistent, unwelcome visitor known as insomnia. Today, we're going to demystify insomnia. We'll explore not just what it is, but more importantly, why it happens and what truly helps. My aim is to offer clarity, practical insights, and most importantly, hope for anyone struggling with their sleep. We'll avoid jargon, relying instead on simple frameworks and real-life understanding. Let's start with a clear understanding. Insomnia isn't merely an occasional restless night. It's defined as a persistent dissatisfaction with the quantity or quality of sleep, despite having ample opportunity to sleep. This dissatisfaction leads to noticeable distress or impaired functioning during your waking hours. Think of it. If you have the chance to sleep for 8 hours, but only manage 4 and feel terrible the next day, that's what we're talking about. Insomnia isn't a single uniform experience. We categorize it in a few ways. There's acute insomnia, which is short-term, typically lasting days to a few weeks. This is often a direct response to a specific stressor, say a major life event, a stressful deadline at work, or an unexpected trauma. It usually resolves once the stressor passes. Then there's chronic insomnia, which is more persistent, lasting 3 months or longer, typically occurring at least 3 nights a week. This is the one that really starts to impact daily life significantly. And it can manifest as difficulty falling asleep, what we call sleep onset insomnia, or trouble staying asleep, like those frequent 3 a.m. wake-ups, which is sleep maintenance insomnia. Understanding why insomnia happens is like piecing together a complex puzzle. It's rarely a single cause, but rather a combination of factors. A very helpful framework, widely recognized in sleep psychology, is Dr. Arthur Spielman's 3 Ps model. Think of it as 3 distinct layers contributing to the problem. First, we have predisposing factors. These are the inherent traits or characteristics that make someone more vulnerable to insomnia in the first place. Imagine a house built on slightly shaky ground. Things like a genetic predisposition to lighter sleep, a naturally hyperaroused physiology, meaning your body and mind are more easily stimulated and less likely to calm down, or even a tendency towards worry and rumination, all fall into this category. These factors don't cause insomnia on their own, but they set the stage. Next, we encounter precipitating factors. These are the acute stressors or specific events that trigger the initial episode of insomnia. This is the earthquake that shakes the house. It could be a major life stressor like a job loss, a relationship breakdown, a medical illness, or even significant travel resulting in jet lag. These are often clear, identifiable events that kickstart the sleep difficulties. For someone with predisposing factors, these events are more likely to push them into an insomniac state. Finally, and perhaps most critical for chronic insomnia, we have perpetuating factors. These are the maladaptive behaviors, habits, and thought patterns that develop in response to the initial sleep difficulties, and then maintain the insomnia long after the original trigger has gone. This is where you start taking poor coping strategies, like sleeping in late on weekends to catch up, spending too much time in bed trying to force sleep, watching the clock, or worrying excessively about sleep. These behaviors, ironically, perpetuate the very problem they're trying to solve. They keep the house unstable, even after the earthquake has passed.
Beyond the 3 Ps, many common elements contribute to these factors. High levels of stress, whether from work, personal life, or finances, are a massive trigger. Irregular sleep schedules, like those associated with shift work or frequent jet lag, disrupt our natural body clock. Poor sleep hygiene, which includes things like an uncomfortable sleep environment, consuming caffeine or alcohol too close to bedtime, or too much screen time before bed, also plays a significant role. It's also vital to recognize the deep connection between sleep and mental health. Conditions like anxiety, depression, and trauma are not just associated with insomnia. They are significant contributors, and often a bidirectional relationship exists, where poor sleep exacerbates mental health issues and vice versa. Similarly, physical illnesses or chronic pain, such as arthritis, back problems, diabetes, or heart disease, can make quality sleep incredibly difficult. Certain medications and hormonal changes, like those during pregnancy or menopause, can also throw our sleep cycles out of whack. At a more physiological level, there's the hyperarousal theory. This suggests that individuals with insomnia are in a state of heightened physiological and mental activation even when they should be winding down. Their bodies might show increased heart rates, elevated stress hormones like cortisol, and faster brain activity around bedtime, making the transition to sleep a constant uphill battle. The impact of insufficient sleep extends far beyond just feeling tired. In the short term, it leads to significant daytime impairments, crushing fatigue, irritability, mood changes, difficulty concentrating, memory issues, and slowed thinking. This isn't just unpleasant, it can be dangerous, increasing the risk of accidents. Over the long term, chronic insomnia poses even more serious risks. It elevates your chances of developing chronic diseases like obesity, type 2 diabetes, high blood pressure, stroke, and various cardiovascular problems. It truly underscores that sleep isn't a luxury, it's a fundamental pillar of health. So, if you recognize yourself in these descriptions, what can be done? The journey to better sleep often begins with a thorough medical history and keeping a detailed sleep diary to track your habits. Sometimes sleep studies are needed to rule out other disorders. For chronic insomnia, the gold standard and often the most appropriate initial treatment is cognitive behavioral therapy for insomnia, or CBT-I. This isn't just about managing symptoms, it's about addressing the cognitive and behavioral factors that perpetuate insomnia. Think of it as learning how to retrain your brain and body for sleep. CBT-I includes techniques like stimulus control therapy, which helps you associate your bed only with sleep, and sleep restriction, which sounds counterintuitive, but actually helps consolidate sleep by initially limiting your time in bed. Its long-term benefits are often superior to medication because it equips you with lasting skills. Alongside CBT-I, lifestyle and sleep hygiene modifications are crucial. This means establishing a regular sleep schedule, even on weekends, creating a comfortable, dark, quiet, and cool sleep environment, avoiding heavy meals, caffeine, and alcohol close to bedtime, and incorporating regular exercise and relaxation techniques, such as meditation or deep breathing, into your daily routine.
Pharmacological treatments also have their place, often for short-term relief or as an adjunct to CBT-I. These include various medications designed to help you fall or stay asleep. However, it's important to understand that there are ongoing debates and concerns surrounding the long-term use of sleep medications. Dependence, addiction, rebound insomnia when you stop them, and side effects like next-day sedation, confusion, or memory issues are significant worries. For older adults in particular, some medications can increase the risk of falls or contribute to pseudo-dementia symptoms. This is why organizations like the American Geriatric Society often strongly advise against certain types of sleep medication in the elderly. As for natural remedies like herbal teas or melatonin, while popular, their efficacy and safety, particularly over the long term, require careful consideration and professional guidance. For example, the scientific community continues to debate the effectiveness of over-the-counter melatonin for chronic insomnia, and its unregulated status in some countries means quality and dosage can vary wildly. The landscape of insomnia research and treatment isn't without its ongoing questions. Beyond medication concerns, there's the complex interplay between insomnia and other health conditions. Is insomnia always a consequence of depression, or can it also be a significant risk factor for developing depression? This bidirectional relationship makes figuring out the precise order and focus of treatment a constant point of discussion. We're still refining our understanding of the exact physiological mechanisms that underpin chronic insomnia, why some people are just wired differently when it comes to sleep. The good news is that understanding insomnia has come a long way and continues to evolve. Researchers are constantly working to refine our understanding of its underlying mechanisms and to develop even more integrated, effective treatment strategies. If you are struggling with sleep, please know that you don't have to navigate it alone. Insomnia is a complex condition, but it is treatable. By understanding the combination of factors at play, whether it's your predisposition, an acute stressor, or the habits you've developed, and by seeking evidence-informed help, especially therapies like CBT-I, better, restorative sleep is absolutely within reach. Prioritizing your sleep is prioritizing your overall health and well-being. Good night, and here's to a future of peaceful sleep.